Well, hello everyone, and it's nice to be talking to you about my past year as Dean. We've had a lot of great projects over the past year, and I'd really like to talk about three of them in particular. Firstly, our position paper on persistent pelvic pain was completed by a superb document development group, including multiple fellows with dual qualifications in gynecology and pain medicine. We had a pilot period for that project, and it was a real delight to be able to see that go forward as a position paper. It's been endorsed by many peak bodies, including the College of Obstetricians and Gynecologists, as well as patient groups who are delighted with our approach. So that's been a real achievement for us in the past year. We've had a number of ongoing projects that are federally funded. So we've had the Professional Standards in Pain Management Education project, which has made great progress over the past year. We've had excellent engagement across the healthcare sector and, of course, across patient groups, and we are very keen on maintaining our focus to include the voices of people suffering with pain. We've also had real progress on the flexible approach to training in enhanced settings program, which is the FATES program, and we've had great engagement across the regions, and there's been some real progress there. I'm especially excited by this project. I'm board sponsor of the project, but additionally I work in a rural and remote setting as well as working in my metro practice, and I think that there is a huge opportunity for both learning but also engagement and good work to be done in rural and remote settings. It also brings us closer to our First Nations across Australia, which is another issue that's very dear to my heart. We have a number of strategic priorities, but of course foremost amongst these is expanding the services that we can offer to people suffering with pain. I was delighted to be able to have 2 visits to New Zealand last year. We had a meeting in September where I was able to visit a number of units across both the North and the South Island, and we also had the spring meeting in Auckland, which allowed further visits to centres in New Zealand, all of whom are doing amazing work. It is unfortunately a matter of fact that our colleagues across the healthcare sector in New Zealand are having a tough time at present. Anything that we can do to support them, we will try and do. But it is a difficult time. On the positive side, I was really struck by the enthusiasm and commitment of our fellows in New Zealand who are maintaining a range of services in some very difficult circumstances. The New Zealand National Committee is very impressive in terms of its focus and its commitment to improving service delivery and also ensuring the welfare of fellows across the country. Whilst currently we don't have a training unit on the South Island of New Zealand, I was very impressed by the enthusiasm of colleagues working on the South Island, and this is an area that I think we really need to develop. It will be wonderful to see training opportunities improving in the South Island. We've had a number of other explorations in areas through our strategic priorities over the past year. The Pain Device Implant Registry was a priority for us and remains one. We were very hopeful that we would be successful in a grant application to the Australian Medical Research Futures Fund to support this. Regrettably, we didn't quite get over the line with that, but we learned a lot in the process. We will continue to push for that, and it has opened up some other potential collaborations that we can have to take that project forward. There are many other issues that we need to address. As always, our interaction with funding systems is not exactly as we would like it, but there are ways of improving that, and I will be writing to the new Australian Federal Minister for Health and Ageing, the Honourable Mark Butler, in the near future to outline exactly where I think the government can help. And obviously our first priority remains to provide service delivery to people who are living with pain. There are other areas that we need to expand, and in particular paediatric pain is an area that is unfortunately greatly underserviced. We have some amazing talent in our paediatric pain specialists, and I would love to see that used better to help the very difficult circumstances of children and families who have to live with pain. Something that always impresses me is the commitment to the faculty that we see from fellows. We see that commitment through our fellowship survey, and it's amazing to see that more than 50% of fellows remain involved in some form of faculty activity, whether that's being on a member of a committee, a working group, a document development group, or being a supervisor of training, being an examiner. All of these roles are incredibly important, and it's amazing that the fellowship participate to the degree they do. It maintains a faculty as it is, which is a world-leading organisation in pain management. We had a really fulfilling Emerging Leaders Conference as part of the overall college program prior to the ASM up in North Queensland. And I was delighted to say that we had 3 real top draw fellows attending as representatives of the FPM, and they participated to a remarkable degree in the overall discussions and debates that we had through that great conference. The jewel in the crown of all of this was the symposium that we had, followed by the FPM's participation in the ANZCA ASM, all held up in Cairns. The local organising committee based out of North Queensland did an incredible job. They recruited some top draw international speakers who provided both superb plenary sessions as well as great participation in workshops. The faculty's overall contribution to that meeting was completely peerless, and I'm so proud of our fellows for organising that meeting. So going forward into next year, we have a lot of things to do, but if we can achieve anything like what we've achieved in the past year, our fellowship will maintain a really safe future for us all. Well done, everyone.